Hello, everybody. My name is David Medina, and I would like to talk about contraceptives, the options available, and each of their individual effectiveness. Contraception, or birth control, is any method, medicine, or device used to prevent pregnancy. Contraception, or birth control, is also used for other reasons besides just preventing pregnancy, like preventing the transmission of STDs in the case of condoms, manage heavy and painful periods, decrease risk of ovarian cysts, reduce risk of pelvic inflammation disease, and they also decrease the risk of ectopic pregnancy. Uh, those those last four apply to like the hormonal methods, right? There are several forms of reversible contraception split into hormonal and barrier methods. Hormonal methods use progestin and sometimes estrogen, you'll see later, to thicken the cervical mucus, thin the uterine lining, and often suppress ovulation. Barrier methods physically block sperm from reaching and fertilizing an egg. Some forms of hormonal contraception include the different types of IUDs, uh, implants that go on the arm, injections, the pills, either in the form of having progestin and estrogen, or just having progestin, a patch they put on, or also a hormonal vaginal contraceptive ring. Um, it is I put the two types of I labeled which had progestin and which had both, because it is worth mentioning that estrogen may increase the risk of cardiovascular disease in women that are older than 30 and in those that smoke regularly. So I just wanted to make sure that everybody knew that. And then barrier contraceptives include a diaphragm, a sponge, a male condom, a female condom, and spermicides. The only contraception that prevents the transmission of STD uh, are both the male and female condoms. Nothing else. So it is very important to make that very clear. Uh, I gather this data from the Centers for Disease Control and Prevention, and it showed that a lot more of the hormonal contraception works more effectively, and a lot of the barrier ones don't work as effectively. But everywhere that I saw, like from the Centers for Disease and Control, or from the World Health Organization, or from like Planned Parenthood, they all said that is best to combine different method. Okay, not loosey goosey combine different methods, but pick one hormonal method and pick one uh, barrier method and use those together for the best outcome. Uh, the best outcome being not getting pregnant, right? Teachers should know that according to the World Health Organization, estimated 164 million women of reproductive age, 15 to 49, are unable to actually get access to these contraceptives for several reasons, like just overall a limited access to it, not a good selection. So maybe they can't use some things, but now they don't have any other options, right? Uh, and what has helped to improve this is organizations like the World Health Organization. They helped update evidence-based guidelines. That way it helps decrease like the fear mongering about side effects. They support supply chains. That way everybody can get better access. And they also help health systems adopt better practices. Uh, Also, naturally, over time, with the development of new contraceptives, it has made it more likely that somebody is able to find something that works for them, which is great. And it is also very, very important to recognize and focus on particularly affected groups like young people, like potentially our students, people in urban slums, and unmarried people. Us as teachers are able to help with the issue by creating a safe space in our classrooms where our students are able to actually ask us about sexual health related questions so we could, have a good conversation to help them, right? Um, Many barriers, like fear of side effects, myths, or cultural pressures, come from misinformation. So we have to be sure to provide our students with very accurate, inclusive, and stigma-free information on contraceptions to cut down on the fear. Provide all our students with a wide variety of like the wide variety of options that I talked about earlier, right? And teach how to access reliable and safe community health services like reproductive health clinics. Uh, and here are more sources. Thank you.